bringing with it some balance and harmony.
Inflammatory lung disease. The autoimmune's attacking the nerves, less stressed. I feel more energised.
Let's have a look at your posture. Up on this side. So it's like this. Okay. And hold. Nice, really solid. And hold. Ah, a lot better. And last one, and hold. Good, adrenals. How does this feel when I'm doing this, Ashlee?
It's quite nice, actually.
Good. This is really tight. Neck release. Absolutely wonderful. Wow, that's so good. Picking up the trapezius, making the most of this beautiful stillness and the whole respiratory tingling where the energy is arriving. You're fine, you're passing everything. You smell nice.
Thank you.
It came in with you. It's lovely. It's very fruity.
Fruity, yeah.
So how are you, Ashlee?
Yes, I'm feeling a bit more optimistic with everything going on. I think we're getting closer to more of a solid diagnosis with my cough, which I've had for the last 2 years. I've been sort of led to believe and diagnosed with inflammatory lung disease. But I've had a recent scan of my tummy and how everything works from the throat downwards. And actually they've discovered my, in quotes, gullet isn't working properly.
Okay, so the gullet's not working properly. In what way? What's wrong with it?
So because I've got the autoimmune conditions, I haven't gone into detail yet with the consultant, but they feel that it's a contributor to what's happening with the gullet. So they think the autoimmune's attacking the nerves.
Okay. Oh, okay.
So it's not working properly, so the food isn't going down.
Yeah.
And it's sitting in my esophagus, I think.
Yes, yeah.
Which is causing me to cough.
Oh.
Because food isn't going down into the stomach.
Okay. And what you've got to be careful, what might happen with that, I mean, you tell me if it is reflux and acid. And what can happen with acid, I've found out recently, is that some people with a recurrent cough think it's respiratory, understandably.
Yes.
But actually it can be acid that comes up and goes down into the lungs.
Yes.
And then can cause infection in the lungs, even pneumonia.
Yes.
Yeah.
Yes. And I think that's what now they think is happening. I've got fibrosis of the lungs, I'm assuming because of that.
Oh, so it's obviously connected.
Yes.
Right, okay. And you've got a hiatus hernia, haven't you?
Yes.
Is that connected to the coughing? Or?
Not entirely sure at the moment. So I still really haven't gone into detail, or we haven't got a plan or anything else at the moment.
Okay, but at least you're finding something out.
Yeah, absolutely.
How do you feel?
I think I feel a bit more relieved. I think I'm sort of thinking I've been misdiagnosed. I might be completely wrong, but that's the sort of feeling that I get, and I've thought it all along.
Right.
And I think your body does know.
Okay.
And the outlook, if that is the case, then the outlook in my life is completely different. So it means, I've got a better and longer possible life.
Okay.
So,
yeah. So other things because I've just had another look at your consultation form. This is your third appointment today, so you've had 2 core therapies so far.
That's right.
And other things you've mentioned are your Raynaud's syndrome.
Yeah.
So that's when we get very cold and no circulation in the fingers normally.
That's right, and the toes.
And the toes.
Yeah.
And how often are you getting that?
Every day.
Every day.
Yeah. Yeah.
And is that connected at all?
Yeah, so again, it's autoimmune.
Is it?
Yeah, it's just, I think it just completely attacks your system.
So, big question.
Yeah.
You may not know the answer to this. I don't even know if the specialists know the answer to this, is why? Like, autoimmune conditions are quite common now. I hear of lots of different varieties of them.
Yeah.
And there seems to be a link with having had a virus. So
Yes.
like a post-viral syndrome, having had a virus, you're recovering, your immune system is low, and then you get attacked by something else that is more systemic.
Yes.
Like this.
Yes.
Did that happen to you?
I think with me, I mean, a lot of the time they do say that trauma can cause autoimmune conditions as well. And I think in my case, I think pregnancies was perhaps
Really?
even though I didn't find it traumatic, I think they were my triggers. That's when things started.
Okay.
With my second child, more so, had, which they thought at the time was preeclampsia, but it wasn't. It was, again, not sure if it was right, but HELP syndrome. So it's a really, really rare post or pre-birth condition. And your organs completely just go into shutdown.
Oh my goodness.
So I had her really early. She was born at 30 weeks.
Oh.
So since then, I think things have just developed from there.
Oh, okay. I haven't heard of that.
Yeah,
So
I
HELP
haven't heard of it.
stands for something then.
Yeah, something quite long.
Okay.
It's
right.
HELLP.
Okay. All right. I'll look it up.
Yeah.
Thank you. So, anything else? So how are you feeling today? And you've had 2 core therapies so far.
Yeah.
Have they helped you?
I do feel that they've helped me. I think they've helped me mentally as well. I feel a lot more less stressed. I feel more energised. I'm really keen to, to do things. So I think it really has, done me the world of good.
Good. Wonderful.
Yeah.
Because something like that could get you down.
Yeah.
You have a family to look
Yeah.
after as well. You have a job.
Yeah.
And all of these things could get the average person down, maybe.
Yeah.
And that can go into something like ME.
That's right.
Yeah, or chronic fatigue.
Yeah.
Because it's a post-viral syndrome. But well done for you. You're really cracking on. And for booking something like this and coming a distance
Yeah.
to really look after yourself and invest in your future health.
Absolutely.
Well done.
Thank you.
Okay, let's see what today offers up.
Great.
So, let's do some tests.
Okay.
Can you put your arms down?
Yeah.
Can you raise an arm? I'm going to push here. You're going to hold up and hold. Okay, so a little loose. Same with this one. Up in the air, I'm going to push here and hold. Lovely, nice and strong. Can you raise a leg? I'm going to push here and hold. Nice. And here and hold. Okay, a little loose that side. Can you raise right arm and leg? I'm going to push with both and hold. Nice and strong. And the left side and hold. Okay, going down. So it's interesting, both limbs separately and together weren't as strong as the right. So your body is telling me there's something over here to have a look at.
Oh yeah, I can feel that.
Yeah, is that sore? Yeah. Okay, so we're going to retest. Can you raise your left arm and leg and hold? Nice and strong, lovely. So that's your subconscious saying, please come and have a look at this. I checked it, I anchored it to say, is it here that's the problem? Retested, went strong. So your subconscious is going, yes, you've got the right place. That needs sorting. So now if you could raise right arm, left leg and hold. Nice and strong. Opposites and hold. Nice, lovely. So your contralaterals are firing. That's really good. That tells me about your jaw. And all your joints. So interesting joints. So let's have a look at your posture. Down on this side, just your shoulder. Up on this side. Yeah, so it's like this. Let's have a feel of the hips. Just pushing in. Can you raise an arm and hold? We don't like that one. Actually, I'm going to use the other arm. I'm going to do that again and see if this arm is stronger and hold. Yeah, that one's okay. Interesting. I should make sure that I use a strong indicator muscle and hold. Lovely. Okay. Just seeing if there's a twist and hold. Lovely. Good. And hold. Oh, okay. So that was the only one. Let's see if it's intact and hold. Nice. Lovely. That's a good pass. So that one. Yeah, it was your left ipsy. That's your hip last time. Okay, can you put your left hand, 2 fingers on your pubis symphysis? That's that hard bone, low down. Can you raise your arm and hold? Strong, wonderful. You can let that go. Can you put a sole towards the opposite knee by bending this knee out, raising this arm again and hold? Lovely. And the other way round with your legs and hold. Fine, really good. That's a really good indicator. So for the most part, your hips are in a good place. Mm-hmm. There's only one twist going on. It's not a double twist. They're intact. And one hip or the other isn't particularly shouting out, apart from when we did the ipsy test. That was this test, and the back of your left hip. So that is called a sacroiliac, where the sacrum meets the iliac bone, is separating a little. So I'll definitely look at that. Your pubis symphysis was good. Your ballet test, that's when you put your knee out to the side to see if your hip is happy opening. Both passed beautifully. Let me see what I did last time. Just wondering about doing some other tests we haven't done before. Yeah, we looked at quads piriformis. They weren't great, so I'm just going to check those again to see if they've held from last time or whether they need a bit more support. So can we bend this knee? I'm going to test this one by pushing this forwards. You're going to keep it bent and hold. Just a little movement, not much. And again, and hold. Nice, lovely. Right, up again. And this time the foot comes over here. I'm going to support the knee and I'm going to try bringing the foot back to me. You're going to keep it crossed and hold. Nice, really solid. Same the other side and hold. Not so much. Okay, so that's your left piriformis. It was right last time. Oh, at least the quads have held. That's good. They weren't great last time. So, oh, and ballet was good. That failed the last twice. And pubis symphysis. Brilliant. You're definitely in a better place. Mm-hmm. Going to have a look at the TFL because that wasn't happy last time. So, straight leg. Letting your foot go into my hand, nice and heavy, I'm coming out. So I'm going to try pushing this foot towards the other foot at that downward angle. You're going to keep it up and out here and hold. Aha, a lot better. Going to do the same again and hold. Okay, so the left was tricky this time. So I'm just going to do a couple of little techniques to see if I can get them firing straight away.
Yeah.
I'm going to rub the sides of your thighs quite strongly.
Okay.
Okay, we're going to try this one first. Straight leg. Give me the weight of it. I'm going to push and hold. Even better, let's see this one, and hold. Okay, still tricky, so your left one needs a bit more help. I'm just going to try and locate the top and bottom of each muscle here. And of course we've got 4 strong muscles in the quads. And I'm pushing with a row of fingers on the barbs. That's the top and bottom of the muscle, which has like Velcro little hooks. And sometimes those hooks levitate, so I'm just reminding them and pushing them back down again for several seconds. Okay, let's do that again. So bringing the foot out, straight leg, nice and loose. I'm going to try pushing down to here and hold. There you go. Did it feel stronger each time? Yeah. Good. Yes, I'd made myself a note at the end of last session when we redo tests that had failed at the start. And those two tests, so the ballet one with your knee out and the TFL, this one we just did, had failed at the end. So I'm really glad we've got that passing at the start of today. Digestion and chest are key ones for you, do you think? Yeah.
Yeah, most probably.
Digestion and chest, yeah. I mean, joints.
Joints are okay at the moment.
Yeah, circulation.
Circulation's poor.
Yeah. Okay. Have I cupped you before?
Yes, we cupped last time.
And how were you after cupping?
Yeah, I was bruised for about a week.
Were you?
Yeah, but I think it was, it felt good.
Yeah. Okay. Good. Because cupping is like turbocharged circulation.
Yeah.
And if your thing is circulation, whether it's to the gut and the digestion or the chest or simply around the body and all the way down to fingers and toes, then it could be key.
Yeah.
So whether we do cupping, I may well do, it's just so great, and especially on a winter's day, it just gets all that warmth and chi going. Or I can, alternately, I could do a couple other things like the massager. That's really good for getting the circulation going. Or some really heavy tuina. Right. Can I have a little feel of your tummy?
Yeah.
Is it okay if I lift your t-shirt? T-shirts?
Yeah.
Can I bring this down a little just to feel the ICV? Thank you. Sorry about my hands.
That's okay.
I'm just having a feel of the valve. It feels a little bit firm. That one feels much better. Spleen's okay to me. Stomach's a little firm, not too bad. Anxiety point's a bit tight. Gallbladder might need a bit of help. Liver feels good. You're on medication?
Yes. I have a long-term infusion for rheumatoid arthritis. So that's, again, slow release. And I also take hydroxychloroquine and omeprazole. Okay,
yeah, omeprazole for the acid reflux and...
hydroxychloroquine, so that's... I think it's an anti-malarial drug which they treat autoimmune.
Oh, okay. Interesting.
Yeah.
And you've been on that for a while?
Yeah, I've been on that for about 4 years.
Uh-huh. And it's obviously helping then?
Yeah, I think so, definitely. Yeah. It's good for energy levels.
Interesting. Thank you. Okay, so I'm going to test a few things and we'll see whether I need to give you an amno-foo today.
Sure.
Can you give me... Right, before we test... let's bend this elbow and put your little finger to your thumb. I'm going to try and pull apart. You're going to hold together and hold strong. So, can you you've got lovely long nails, so you might want to put knuckles in instead of nails. But can you put 2 fingers there quite deep in, and then bend this elbow again, giving me that little finger and thumb, and hold. Really strong. Lovely. Can you put a flat hand here? Yeah. And then bend and hold. Strong. Can you put just ends of fingers, not pointed, that's it, lovely. And hold. Brilliant. Okay, so doing well here. And then in between the V of the ribs and hold slightly, okay. And then ends of fingers again here, lovely. And hold. Good. Okay, passing all of this. And then that finger under that left rib and hold. Okay, just moved a tiny bit. That's spleen. And then 2 fingers deeply into this point here, it's another valve, and hold. Okay, that's good. And then 2 fingers deeply under the umbilical and hold. That came apart slightly. You can release this hand. And I want to test here again and hold. Lovely kidneys. And last one and hold. Good, adrenals. Okay, so there was only Ren and spleen and anxiety point. So I don't think it requires a whole amno-fu. It's interesting because you've come in with symptoms for the gut, and yet I think I could treat the gut better through doing cupping through the back to feed that blood supply. And I will be doing some qigong, maybe a little calming to those 3 points that needed it here as well. So I'll come back to those. Can you turn over for me?
Yeah.
So this is the hip that came up at the very start of the treatment. This is the Ipsy strain on the left side that we revealed with the left and right, left arm and left leg test. So to me it just feels a little bit loose, like it needs to be more intact. Like the muscle power needs to come down here to help strengthen that link between the iliac and the sacrum. And there's quite a strong curve here, which is nice. We want a good curve. So the sacrum is coming down like this, and then there's a hinge point, and then the lovely flattish and then raised lumbar. And at this hinge point here, we can get pain because of the weight of the back coming down to this point that then sits on the upper sacrum. So I always make sure when I have a lovely curve like this, that this area gets lots of attention. It needs a good amount of tuina, some rocking, moving, almost like I'm making your body do some yoga. How does this feel when I'm doing this, Ashlee?
It's quite nice, actually.
Good. So I don't know if you can feel that, but if I'm coming up the spine like this, so your spine is moving beautifully, and what I want to happen is when I'm pushing, that the opposite sides of where I push almost give like this, so they're coming the opposite way from the way I'm pushing.
Okay.
So that's happening here. You can feel the hips are rocking as I push this way, the hips are coming this way, opposite. And the same with your head, it's both coming towards me as I'm pushing away, which is absolutely fantastic. However, when I come up to this point, oh, I can feel that. I can almost feel that in my own back when I'm doing that. So this is fine. So here's your bra line. So on and below bra line, absolutely fine. Lovely. As soon as I get to just above the bra line, this is when it starts going absolutely solid. And instead of your head and body coming towards me, you're going with me. So it's like I'm pushing an iron bar as opposed to a piece of rubber.
Yeah.
And we should be rubbery, really. I know we've got bone in us, but our soft fascia should allow our bone to wobble around. So yeah, this is really tight and understandable. So your lungs that are feeding and showering your whole body with water and nutrition are quite congested, and that is also being caused by a very tight spine. So if I can loosen this basis of what's feeding your lungs, i.e. the spine, the circulation and the nerve system that goes through the spinal column, then that will really help your health going forward for your lungs, your breathing, and hopefully your digestion. So this is the area I'd love to get some cups on again, if that's okay.
Yeah.
So I'm just feeling into the fascia in between the spine and the scapula, this lovely soft, as it should be, soft fascia here. And again, it's fairly firm. It's not too bad. I've seen a lot worse, but it, and this is giving already, that is giving much better. I think the body is loosening, trusting me, warming up. If we saw the skin now, it would be probably quite rosy. That's probably quite sore, but getting better?
Yes,
Yeah?
definitely.
Yeah. Right, picking up the scapular fascia. Lifting it off the bone. So sometimes when we find tightness, instead of spending all our time up here, we'll actually spend some time lower down or in another place on the spine, so that when all of this moves beautifully, it has a reverberation up or down the spine and helping the whole length loosen and let go. Much better already. I'm just going to give it a little wing stretch to separate those scapula, get them mobile. Lovely, really good. And a walk down each side of the back to encourage separate movement of each vertebra. Putting my whole body weight to the sacrum, the lumbar, and the thoracics. Okay, if you could take your top off for me. Just going to bring these down slightly. Sorry, making you jump. Oh. Is that okay to there? Yeah. Yes, as I thought, your back's nice and rosy here already. How are your shoulders? Do you get any aches and pains there?
Yeah, I do get quite a bit of pain in my shoulders. Not so much as I used to. But I'm hypermobile, so I think they're very loose.
Okay.
In the sockets, I should say.
Yeah. Okay, I'm going to put the first cup here. So this is a Chinese therapy, ancient therapy, been used for hundreds of years, which basically warms the body by putting, oh, it sounds like there's a plane doing tricks above us. Warms the body by creating a vacuum with the heat into the glass cup, and then that vacuum calls up the blood and the chi, the fascia, gently up into the cup. And that has the effect of bringing the circulation down to this area. So when cupping, I tend to start off at the top of the spine, nearer to the heart, and then coming down the spine in order to bring that circulation that might be a little bit slower as it comes away from the heart and downwards, to bring it down to the hip area. And I'm looking at the cup colours all the time, so it should go a nice rosy pink colour. But if they are pale or particularly dark, so towards the darker red, purple, or even into black, then I know that that area needs more attention. So these are lovely rosy, gentle rosy colours at the moment. You've got no marks yet, Ashlee. And when there are marks, they don't feel like a sore bruise, because it's not the same as when the skin is bashed and creates a pain there. It's very different to that. It's just the blood vessels that come to the surface and make that colouring because of the pulling of the cup. And they can last up to 2 weeks, but that's uncommon. It's normally just a couple of days or a few days. So just repeating those lines down each side of the erector spinae. Lovely and rosy up here where I've been doing the tuina. And as you can see, it starts to go paler here. So we need that circulation to come down to the digestive system. And those 3 areas that needed extra attention when we did the kinesiology to the abdomen earlier were the anxiety point, the Ren. So these are both Chinese acupressure and acupuncture meridian points, and also the spleen. And the higher the flame, the more suction, the more circulation it's going to boost. That feel okay? Mm-hmm. Yeah, well done. So this is really helping now. So what I was doing before is called flash cupping, on and off. And now this is the moving cupping, where I create the suction with that vacuum and then bring the cup gently down the side of the spine all the way to the kidneys, just above the waist. Oh, you've got sunshine on you now. Oh, it's nice to see sun, isn't it?
Yes.
Oh, what a difference. Is that sore there?
Yeah, a little bit, yeah.
But you're coping?
Yeah, that's no problem.
Oh, well done. You're a trooper.
Mm-hmm.
Lovely. Get it all the way down to the hips and the stomach area. So I'm using nice large size cups today. And they're really helping bring that blood down. You can see tiny little ash marks. That's just from the cotton wool. And then one to the side of the hip. Lovely. They okay?
Yeah.
They're doing a good job there. I'm not going to move them because I think that would be too painful. I'm just going to leave them stationary for a while. Just going to put another couple on your lung area here. There we go. So you've got a good amount on there. They're nice size. All right, let's have a look at the reflex points. We'll probably go over time, Ashlee. Is that okay?
Yeah, that's fine.
You sure?
Yeah.
Thank you. So, loosening and isolating, freeing up that big toe neck, which is also the neck of the body in reflex terms. It's quite solid. And then bouncing down the toe pad, which is the scapula. Lovely. Really good movement. That will help rebalance that ipsy strain, the sacroiliac separation. That's it, lovely. Oh, and a little bit tighter this side, but still giving, still nice and loose and trusting. That's good. And then up with both, nice and heavy, beautiful. So trusting, nice. Just rebalancing those hips, making sure they're level. And then that piriformis. Good. Then onto the sacrum. Feeling that rocking of the sacral bones, those 5 bones fused together, and they rock with the pulse of the cerebral spinal fluid. And this is key to our immune system, our neural, the nervine system, and the communication between the two. Finding that lovely moment of stillness to reset the body homeostasis. Working into those lungs. Slowly working the cup up and around, over, up to the cervical lymph to clear away toxins. So you've got a few rosy marks, but they're not too bad.
Okay.
I don't think they'll last that long. They're just a nice colour as well. I'm just going to have a little feel of your back. That feels so much better. What a difference here. We definitely did the right thing.
Yeah.
Can you feel that ankle like jolting
Yes.
a bit? It's does it ever fail on you?
It has done, but not for a long time.
Okay. Let me just give it a little extra TLC.
Thank you.
Feels like it's over here. It's on the outside. It's not doing it now. It's good. Yeah, you're still higher here. Let's have a look at your feet. Feet are level. Okay, working on that shoulder and right side of the neck. Good. So just doing a little arm float, which means qigong, some healing. And when I'm holding the arm, I'm actually feeling into the upper spine. So the thoracics and the cervicals of the neck. That's it, nice and loose. Oh, hello. I think that was your wrist, wasn't it?
Mm.
Heavy, 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 heavy. So bringing my hands all the way down to T8, about bra line, and then checking and encouraging each vertebra to move left and right as I walk my fingers up the spine. Just moving the pillow. So that's saying hello. That's about C2 popping out to the left. We're going to do a neck release. Absolutely wonderful. Wow, that's so good. So letting the head go really heavy, beautiful, while my fingers are in a row at the base of the occiput and top of the spine. To stretch, turning to feel into the side of the neck bones. Oh, hello. And then spinal processes coming up. Not bad. Turning. And then adjusting at the neck, allowing for more movement and mobility so that the circulation isn't hampered, thus relieving and preventing any congestion causing headaches and migraines and brain fog. And then each side of the neck fascia coming up for another neck release. Beautiful. And a lengthen, balance balancing the line, pushing each shoulder down from the mid-trapezius outwards, turning the head and lengthening and supporting. Picking up the trapezius, it feels good. Bringing the cushion back in. Yeah. And a little qigong, healing to the temporals, the occiput, with fingers each side of the atlas and axis, the very two top bones of the spine, bringing in some intended healing. Making the most of this beautiful stillness. Feeling the energy travel all the way down the spine. Feeling energy wash around the hips, flood down the legs, arrive at the feet, and then wash down the shoulders and arms, arrive at the hands, and the whole respiratory and digestive systems are flooded with good energy. And that is a physical sensation of tingling where the energy is arriving, bringing with it some balance and harmony to the immune, nervous, and endocrine systems. And keeping your eyes closed and taking a nice long breath. And sending your breath all the way down to your feet and your fingers. And feeling that breath arrive with tingles. And then gently stretching out through fingers and toes, palms and soles, And then if you feel like it, turning into the wrists and the ankles. And then turning into shoulders, rotating them one way and the other. And then arms up over your head for a whole body stretch. Okay, so when you're ready, I'm just going to retest a couple of things that weren't happy at the start. And I think they're going to be happy now. So we've got left ipsy, hips and left piriformis. So can I have your left arm and your left leg and hold? Rock solid. Can you bend your knee? And bring your foot over to me. I'm going to try pushing your foot back. You're going to keep it over here and hold. Brilliant. So that's your piriformis in your hips. That's sorted. And the first one was your ipsy test, the sacroiliac, which was that really sore place back here. And now your abdominal 3. I'm thinking they might be better anyway, even though I haven't done any directed attention there. But if not, I'll do something for them. So can you put 2 fingers, in fact these 2, this hand, and then give me little finger and thumb and hold. There's no moving. And then a line of your finger here under that rib, perfect, and hold. Wow, solid. And then 2 fingers again just under the belly button there and hold. Fine. I think all that cupping brought all the attention down to this area. You're fine, you're passing everything.
Right.
Whereas at the end of the last time there were a couple that you weren't passing. There was lots that you did, but so the ballet and the TFL, but they're fine as well. So
Good.
I think you're going to be in a good place.
Good. Good.
You feel good?
Yeah. Feel really relaxed.
It was very relaxing, and we went over time, so you've been in a beautiful, still place.
When I've been here, I always feel like I've really been pampered